about ensuring that there is equitable access to healthcare that's appropriate and accessible, and that we are advocating for First Peoples. We've had an increase in the number of First Peoples health workers, some of those in formal health practitioner roles, and most of our universities offer additional support for our First Peoples students coming through. And we have seen an increase in numbers in our health disciplines over the last 10 years, with quite significant not individual, but specific health units supporting health, First Peoples health students, making a huge difference to their, and I think, as always, far better to hear their voice and their experience of healthcare and what worked for them, what helped them, rather than me saying, we can provide this, you should come and access this care, but rather, when we access care, this was the experience that we had. So, trying to make those changes so that we are actually providing care that is acceptable. The next slide, Elizabeth. So when we talk about culturally safe care, it's very much about how that care is provided rather than what care is provided. And I think when we look at that series of videos that you've produced, Elizabeth, it's very much about how that care was provided and delivered, and how, that non-inclusion can be really challenging for anybody. I think for our First Peoples, that's really quite challenging when they don't feel that they're being heard or being supported. So when our health practitioners are looking at delivering safe, accessible care, really aiming to be free of racism, when we know that, within our societies there's an incredible amount of inherent racism, but by really starting to acknowledge and recognise that power imbalance between practitioner and patient. And Sandy, you've summarised that really well in your contribution to the newsletter, but also taking time to reflect on that knowledge, the skills that we've developed, attitudes, the behaviours that we display in our professional lives, and then thinking about conscious and unconscious biases. And it's a really interesting exercise when you do this with novice nurses, but also with health students, as they start to unpack their own conscious and unconscious biases that they may or may not have been aware of. So just to summarise, when we look at how healthcare is provided, and again talking specifically about our First Peoples, we need to consider behaviour, attitude and culture of providers, and we've all worked in units where the culture isn't great, might even be described as toxic. So we have a work environment that's really challenged. It's going to be even more challenging to provide culturally safe care. We need to look at how that care is provided and what policy and procedure underpins that provision of care. And then also looking really specifically at that provider, whether it's that individual provider or that facilities provider's ability to recognise, address and prevent racism. So when we talk with our First Peoples about how they experience healthcare, they want to not only feel safe to access care, but they want to feel connected to culture. So we do have only a very small number of Indigenous healthcare centres. We have a centre of excellence in Brisbane that really has achieved amazing things. We just need, 20 more of them. But they've done really well. They really focus on ensuring that if Indigenous health workers aren't available, that they have an elder available to accompany patients for their treatment and assessment. It's an environment where cultural identity is really respected. So, in Northern Territory, I've visited a birthing unit in Alice Springs run by Indigenous midwives, and again supported by elders. So a lot of the aunties are there supporting the younger women. birthing and during that early parenthood phases. But we know that it can only be defined by those who receive healthcare. So that, you know, the people that are accessing healthcare are the only ones that can really say whether they felt safe accessing the care and whether the care was appropriate for them. So sometimes it is about those simple questions. And then the last thing that I just wanted to talk about briefly is the experience that our health students have during international placements. So this is something that I've been involved with for over 15 years, minus a couple of years in the wilderness for COVID. And the experience of the students is very much that they're no longer the majority culture. So they don't speak the language. They often can't even order a meal in a restaurant. They can't have a really in-depth conversation with the clients that they're caring for other than through an interpreter. And they're providing healthcare in a setting that's really unfamiliar to them. So helping them to really address their self-belief, their norms, their cultural values before we go is really important. So we do a lot of work prior to departure in relation to not only cultural safety, but also about what are some of the cultural norms in the countries that they're going to be travelling to. And we predominantly travel to Southeast Asia, so Thailand, Vietnam, Laos, but we've also taken a group of Pacific Islander students who are doing an AusAid program back to their home country. So that really flipped all of this the other way, where for myself and a couple of the Australian students who went, we had to very quickly understand not only cultural norms, but how their healthcare was delivered and what their expectation was of healthcare within that country. So we talk to the students a lot about how and why people might want to access the clinics that we run, and we run very basic primary healthcare clinics in remote villages where we do a lot of health assessment, a lot of health education, a lot of health promotion, and we work directly with the local health workers to ensure that we're not doing the, you know, helicopter in and say we can fix everything and then go home again. So the students live and work they live in homestays and work in the local villages. So they're very much immersed in everything that's going on in country. And it gives being immersed and living locally really helps them to understand and acknowledge the social structures within these small villages, very much family-based. When the village is introduced to us by their elder or leader, they talk about how many families there are living in the village rather than how many people, which was, you know, really quite refreshing for me the first time that I heard that speech. The other thing that's really important is that we not only have local guides who interpret for us, but they're with the group the whole time. So there's opportunity at all points for students to clarify and query what might be happening, what might be different. And they come away from these experiences really feeling that that feeling of what it's like to be in somebody else's shoes, to view the world through a different lens. And it's quite a powerful learning experience from that perspective, as well as many, many other things that they experienced during that time overseas. So just a few references there. And I think that's me done, unless there's any questions.
Doesn't look like there's questions, because I think our group are very culturally tuned and sort of aware of what we do. I'll just go to the next video